Greetings, everyone. Welcome to the new WCEG Network on the WCEG Talk Radio. We are a worldwide community empowerment group where we speak life into the community. I'm Dr. Babs, your show host for this evening's segment, Holistic Perspective. We are going to have a wonderful hour of empowerment. We're going to encourage each other, and we're going to be educated as we discuss breast cancer risk reduction using lifestyle medicine. This is Breast Cancer Awareness Month, and we want to be prepared and be empowered. So we are live on all your social media, online streams, Twitter, YouTube, Facebook, IG, and the WCEG Talk Radio Network. So please tag your friends, your neighbors, share with your neighbors. Stay updated with all our programs. We are here to serve you, and we appreciate your support. Before we get started, I have two quick disclaimers. The information shared on this talk radio today is not intended as medical advice. It is intended to provide some inspiration and education to support your holistic wellness journey. And I would like to mention that the views and opinions expressed by either myself as the host or our guest does not necessarily reflect the views and opinions of the WCEG Network and management. I always like to start with an inspirational quote, and this goes by Mother Teresa. It says, "I alone cannot change the world, but I can cast a stone across the waters to create many ripples." So very powerful, very uplifting to know that we are not islands on this planet Earth. We are here to serve one another. And as we care for ourselves, we care for others. And that's what this community is all about, the WCEG. They've created several ripple effects. So the question today is, what ripple effect are you creating? Whichever one you are, make sure it's a good one. Well, let's get started. If you're just tuning in, welcome, welcome, welcome. Welcome to the WCEG Holistic Perspective this evening. We're glad that you're here. We're going to have a great time. I'm Dr. Babs, your host today. We're going to talk about breast cancer reduction using lifestyle medicine in observation of this Breast Cancer Awareness Month. My goal this evening is to have a conversation about the following. What are our risk factors for breast cancer? We're going to discuss the lifestyle factors that influence breast cancer. And we're also going to review breast cancer screening guidelines. There's so many of them out there, it could be confusing. So I welcome your engagement and your questions. We are stronger and healthier together when we communicate and dialogue. So we're going to start off with a PowerPoint. It'll help keep me on track. It will help keep me on track. All right, so let me go ahead and share my screen. All right, so let's go ahead and get started. So as I mentioned, I am Dr. Babs. I'm a wellness strategist, a family medicine, lifestyle, and obesity specialist, and I am really pleased and honored to be your host today. So we're going to talk about these objectives. I already outlined them. Let's start off by talking about the breast cancer facts. What are those facts that we need to be aware of? So breast cancer is the most common cancer diagnosed in women after skin cancer. And breast cancer is the second leading cause of death, cancer death in women after lung cancer. In 2021, there was over 280,000 new cases of female breast cancer diagnosed in the United States. So it's more common in women, but some men, yes, have had one or two male patients that had breast cancer. So the cure rate, good news, it's improving. But that has only occurred with screening. So that's why we continue to have this conversation about the importance of screening and its relevance. So let's put it in perspective. 1 in 8 women will be diagnosed with breast cancer in her lifetime. That is alarming, isn't it? To think that for every 8 women that you see, 1 person is going to be diagnosed. So what can we do about it? How can we be in a better place to guard against this disease that is rippling into our community. I want to give you more data that gives us a relationship between race and breast cancer. So this data came from CDC, and this was pulled from 2012, and it's not too far from this data where we have white females, Black females affected, just a mild difference in terms of diagnosis, but in terms of death, unfortunately, Black females tend to die more from breast cancer than white females. So the question is why? Why do we see that? What's the issue? What's the concern? Does it have to do with early screening, early detection? We're going to talk about all of that this evening. What's about age? What does age have to do with it? Especially in these times where we have so many guidelines out there that, I'm sure you've heard, and you might have been aware that, it was 40, once you're 40 years old, you get a mammogram, but then the ages begin to change, where they say 50, you hear some say 60. But this is a data to give you some perspective. In the younger age, it's not as high, the risk is not as high, but as you get older, you see the numbers begin to taper down, right? And that's why I usually say by 75, that's when you stop, because the older you get, the increase in incidence of breast cancer. So we need to be quite aware of this. Now, what's about genetics? There's always been that conversation. Know your genetics, know your family history. How strong is it? That's the question we're going to pose today. For many years, I thought that a lot of all our cancers are genetically disposition. So unfortunately, there's not much I can do about it. It's in my genes. I'm bound to have it. Yes, there is some truth to that in terms of genetic disposition, but based on the most recent data, it shows that a good chunk of cancer is sporadic. So more of environmental influence. You see that 15 to 20% is more familiar. Genetic is 5 to 10%. That is alarming, that it's not as significant as we used to think that it is. So we need to definitely guard against the other numbers that has no genetic disposition. A lot of times I encourage myself as I tell my patients that the genes definitely could be present. That just loads the gun, but it does take environment to pull the trigger. So what is the BRCA genes that we're taught to, the BRCA genes? And that's just the genes that is associated or correlated with breast cancer. You might have heard this a lot, the BRCA1, the BRCA2, the chromosomes, those are what our genetic disposition, what it's made of, the consistency of our genes. So this is exactly what it looks like. And that is where you hear some people go for genetic testing, and they're specifically looking for those BRCA genes, if it's present, and how high is it in the body. So let's take a minute and just review what are our risk factors, right? So we have non-modifiable risk factors, and we have modifiable risk factors. Now, what do we mean by non-modifiable? Meaning you cannot do anything about it. It's just what it is. You just got to accept it for what it is. Female, increase in age, we're all going to age. We can't slow back the clock, right? Inherited genetic mutation, a prior history of breast cancer. If we've had some lesions in the breast, there's not much we can do about that. Our prior history of thoracic radiation. So maybe we had a lesion in the chest wall, thoracic is chest wall, and then increased breast density. Some people have that more than others. Strong family history, ethnicity and race, and reproductive history. So pay attention to these risk factors. Reproductive history, meaning that when did you start having babies? Do you have babies? When did you start your cycle? Because it has some correlation with how much estrogen your body has been exposed to. Now, let's talk about modifiable risk factors. And what does this mean? This means risk factors that you can do something about, right? So what can you do about these risk factors? So Alcohol consumption is definitely a big one that the data has showed some correlation. Postmenopausal obesity. And when I refer to obesity, that means a BMI that is greater than 30. So just for some background, a normal weight is anywhere between 19 and 24.9. Anything over 25 to 29 is overweight, and anything over 30 is obesity. So that means for your height and your body, the weight that your body is carrying, it's calculated by the basal metabolic index. Now, physical activity is also one of those risk factors. If we're sedentary, a lot of people have like sit-down jobs, and unfortunately, when we're so busy doing what we're doing, and I'm guilty of that, we tend to forget to stand up and move. So it's not just the exercise where you're intentionally moving your muscles, it's also being active through the course of the day. Tobacco abuse, one of those risk factors. Tobacco abuse can be blamed for everything because of just all the chemicals that our body is exposed to. It causes a lot of reaction in the bloodstream, causes a lot of inflammatory signaling. So yes, tobacco abuse is one of those risk factors. Reproductive history, like I already mentioned. Breastfeeding, I'm sure we recall time and time again where breastfeeding has been encouraged because studies have shown that it reduces the risk of breast cancer. And postmenopausal HRT, and what that means is hormone replacement therapy. So all these things are things that we can modify. All right, so let's take a deeper dive in when should you think of hereditary breast cancer. So these are the things, because I'm sure you're wondering, okay, you just mentioned, Dr. Babs, that we have modifiable risk factors and we have non-modifiable risk factors. Okay, so what do I need to know? What if I don't know my family history? What if nobody talks in my family, nobody says a word, we don't know what anybody has? Well, that could be a challenge, but there are definitely ways around it. Asking distant relatives. I know that, we try our best to be in communities where we support each other. And because we're trying to make the education and awareness more, people are actually coming out of their shell and revealing more and more, because as you would see later down in the slides, that breast cancer screening saves lives. So we need to know. So what are some of those things we need to pay attention to? The BRCA 1 and 2 genes, you definitely need to look out for that if that is present. I'm sure you've heard of several celebrities that have found that positive and have had a bilateral mastectomy because they're trying to be proactive and not reactive. Having 2 breast primaries in the same individual, having greater than 2 family members on the same side of the family, those are things to pay closer attention to. Or if you have a family member that has had an ovarian cancer, fallopian cancer, or any peritoneal cancer, and peritoneal just means anything in the peritoneal cavity, so the abdominal cavity. Other things to look out for: first and second degree relative with breast cancer, less than 50 years old. Male breast cancer, as much as it's not as common as others, it can also be very, very dangerous or fatal, as I would say. And then having a high risk population, so Jewish, that's definitely more of a high factor to pay attention to. And then other genetic syndromes to pay close attention to. And this can only be detected by going to the genetic doctors, where they will look out for P53 or P10 or familial pancreatic cancer. So these are some things, and I hope that you're taking notes, because if you identify any of these are questions that you need to ask your physician, so that you are being proactive and not reactive. All right, so now we know a few things. We know the stats, we know our risk factors. How do we go about guarding ourselves against breast cancer? First and foremost, we need to do a complete comprehensive family history. You have to find out what's in your family. You have to not just check with your mom's side, but your father's side. The The second thing is consider genetic counseling and testing. So let's say you have a distant aunt, or you have a mom, or on your father's side, whichever the case might be, you might want to consider going for genetic counseling. So not just getting screened, but also genetic counseling to see, okay, well, this mammogram might have been negative now, but what are my chances of getting it later in the future? I've had family friends where they've had a family member test positive, and so they went to check, and then the genes were not isolated, so they were fine. Well, I've also seen where the gene was isolated and they had to make a decision whether they wanted to just do a mastectomy, removal of the breast, just to prevent future occurrence. So that's number 3, which is breast cancer risk assessment. Now, when we come to breast cancer risk assessment, this is where you identify those lifestyle habits that you have that could be putting you at risk. So that is where we have to be very cognizant. Now, genetic, yes, and a question came true about genetic testing. It can be on the pricey side, yes, but there are resources that help, and I'll share that later down in the slides, ways that you can get it at a minimal cost. Now, number 4 is definitely something that is not expensive. Lifestyle modification. And our topic today is breast cancer risk reduction using lifestyle medicine. And I'm always excited to talk about lifestyle medicine because it is free and available to all. Now, as we proceed, let's talk about benefits of screening mammography. So again, as I mentioned, early detection saves lives. All right, majority of breast cancer in the United States are diagnosed by having an abnormal screening study. But for that to happen, you'd have to go for your annual screening. You have to figure out, when am I eligible for a mammogram? So that we're going to talk about when you're eligible for it. But it's so important, early detection. And if it's detected early, definitely there's been data that has shown significant improvement and resolution where a patient actually lives a fulfilling life. But again, it all goes down to early detection. All right, as I mentioned, this saves lives. Now, one thing I want you to look at, just in case for any of our listeners that hasn't seen what the mammography looks like, if you see this, I don't know if you can see my cursor, this is a 2D. You see something a little bit highlighted, and then you see on the other side where the red cycle, so it shows you more of a highlighted demarcation there. So it's more thickened. So it gives you a sense that something is going on there. And in the past, I've had a few patients where they've seen something that seems a little bit suspicious and they've had to repeat mammograms just to be on the safe side. So it's not uncommon that you might see something a little bit off, depending on how dense the breast might be, but definitely making sure that you follow up and have a more conclusive mammogram that will let you know for certain if it is cleared and you can go back to your regular screening. So what have we talked about so far? 5 steps to detecting breast cancer early. You practice your routine self-exams. Now, there's been some controversy about doing breast exams in the clinic. So some of you have had patients come and say, why are you not doing a breast exam for me? Well, we still encourage women to, while you're in the shower, preferably after your cycle. Don't do it before your cycle because your breasts are going to be tender. Our breasts are usually lumpy, all the changes that our bodies go through. So you want to do it after your cycle, right? If you still have a cycle. But routine on your own, yes. The reason why the guidelines kind of shied away from all providers, especially in the family medicine practice or the surgery practice or OBGY, is because they found out that we were doing so much more mammograms because if the breast was lumpy, then all of a sudden we felt that we found the lump. So, but again, we still encourage you, just be on the lookout, pay attention to anything that hasn't resolved, pay attention to when you're doing those examinations to make sure you're not getting anything false positive. I mentioned know your risk, right? Know your family history. Visit your doctor regularly. I cannot overemphasize this. When you're at your doctor, it's an opportunity to ask all the questions you want to ask. I always applaud my patients when they come and they have questions for me. They say, I'm sorry I have so many questions, but no, ask your questions. Ask your questions so that you can be better informed. All right? Know when to get a mammogram. And I'm definitely going to share this because I, on my own too, when I go for my physical, my annual, and my doctor tells me it's time to get a mammogram, you know, I pull up the different guidelines to see if it is time, certainly. So we're going to talk about that. And then you follow up. You don't want to just get it one time and then just say, that's it. It's a continuous screening, and I'll share that with you, what that looks like. All right, so this is what I want to share with you. Question about how often, when do I get it? There's been all that back and forth, but the American Cancer Society has given us a really good chart here to look at. So mammograms, because as we, you know, when you're in the teenage age, you know, the breast is growing, there's all this fibrocystic changes, lumps here and there, depending on your cycle. So really, we say no mammograms in the early, you know, 20s and 39s. But when you turn 40, definitely there's been some guidelines that would say stop, like the ACOG, which is the American Gynecology Association. They actually start at 40. So this is where you're going to have that one-on-one conversation with your physician. You have to have that conversation. If there is a family history though, family history, you got to start earlier. So let's say you have a family, a mother that was diagnosed with breast cancer at 40. You're going to start 10 years earlier than when that they were diagnosed. All right. So 40 to 44, the old guideline was annual, but ACOG still does it, which is the Gynecology Association. It's optional. When you turn 45, though, you do need to be doing it annually. When you're 55 plus, it's every 1 to 2 years. Now, the way I follow the American Association of Family Physicians as well as the CDC. The recommendation there is once you turn 50, it's every 2 years. Once you turn 60, it's every year till you're 75. But again, have that conversation with your doctor. If there's a family history, if you feel anything abnormal, you need to do something right away. Now, on the right-hand side, this just speaks about breast exam, clinical breast exam, which I already spoke about, right? That you still do it, but you don't get it in the doctor's office. You might still have some of your doctors that will examine your breast, but it's not uncommon to see that you wouldn't have any. And I like these questions that are coming through. The question is asking about men. Is the guidelines the same for men? No, so because the guideline is more for breast cancer is commonly seen, you have that 1 in 8 in women. That's who the mammogram screening is for. It doesn't apply to men. Now, if there's a family history, yes, they will definitely have to have that checked. Yes, thank you so much for bringing on the questions. That's great. So now let's talk about what to expect when you go for a mammogram. I know it's daunting. Before I started getting my mammogram, and I'm 45, I was following the American Association of Family Physicians, where they say 40, you have that conversation, it's optional, you know. So I did get my first one as a baseline. I was anxious because I heard it's so painful. You're going to hurt the whole day. You know, you hear all sorts of things that I've had patients tell me I am never going back again. They smashed on my breast. It hurts. And, you know, when we put things in perspective, it doesn't take more than 30 minutes. And that little worth of pain, I think is worth the life of knowing that you're fine for now, right? And that there's no breast cancer going on. So I want to just reassure us that please, it just takes 30 minutes or less. The breast, yes, is going to be compressed because they want to find lumps. They want to find anything that has changed the structure of the breast tissue. So you will feel uncomfortable. Some people have said that they've taken some pain reliever before the procedure. All right, so it's going to be on an X-ray. It's going to be penetrated. It's flat and horizontal. So there's a flat view and a horizontal view. The technologist definitely they would ask you if you're feeling uncomfortable, they can stop. They just have that communication with them so that they know how you're feeling. But it's not a life or death, meaning where you feel like you're so uncomfortable you're going to pass out. Definitely make sure that you're eating, you're full, your tummy is full, and you're not feeling dizzy or anything. And stay hydrated, of course. When we're hydrated, it helps to minimize how much pain we feel. All right, so we talked about when to screen for breast cancer. We've talked about what the procedure is like. Now, there are some challenges though, right? And we want to be cognizant of that. The challenges, especially the first one that I can think about, is COVID. We're in the midst of a pandemic. A lot of our elective procedures have been postponed. I've had so many patients that have had to rewrite the mammogram, because the mammogram that they were scheduled for had to be recanceled and all of that. So this is just, I'm glad that we have this October month as an awareness month, and our numbers are beginning to decline. COVID numbers are declining, and we pray that it stays that way, and things are beginning to open back up. I know Grady, where I see my patients are beginning to schedule for their mammogram. So please schedule those mammograms, have your provider put those orders in. So some of the other challenges is, if there's a new system, a new process, patients' fear and reluctance and confusion. And I hope that I've been able to, kind of reduce that fear about it's a short-lived discomfort that is worth all the knowledge that you're fine, and I know that some people have lost their jobs during this COVID period. I do have some resources to share with you if insurance is a problem. Breast screening, there's several ways to get it at minimal cost and sometimes even free, because we know that breast screening saves lives. All right, we have all these racial, economic, social disparities and all those things, but they're definitely way out. My philosophy is there's always a way out. We have tons of resources that are available, and we should not hinder our health because we're worth it, that we avoid getting these necessary screenings that can save lives. So even though these challenges are there are ways around them. All right, so what are some of the ways that we can reduce our risk for breast cancer? As you recall, I said that 15 to 20% is genetic, and the rest of it is familiar or environmental. So how can we reduce our risk? Lifestyle medicine is a form of medicine, evidence-based, that approaches the health by preventing, treating, and reversing chronic diseases, and also includes cancer through our behavioral lifestyle. So adapting 6 main pillars, right? And these are the pillars you see before you: healthful eating, where it's mostly plant-based foods that are not engineered in the factory. We'll also talk about increased physical activity, managing our stress levels, improving our relationships, because if we have relationships that are not fostering good health, it will just give us more stress. Sleep is definitely one of the pillars, and avoiding risky substances. So let's specifically talk about breast cancer. How can we minimize breast cancer? Generally, cancer overall, having a healthy weight is so important. It's important because when we have an unhealthy weight, it causes a lot of inflammation. And that is where, unfortunately, cancer comes in. When there's so many unstable cells and they begin to replicate because of inflammation in the body due to increased weight gain, that can lead to a cascade of events. So having a healthy weight, healthy for you, not healthy for the next door neighbor or your friend or your family. We're all different. The same children in the family can have different structures and sizes and shapes. So what is healthy for you? And that will be a conversation to have with your provider. Find out what is your BMI, find out what is your waist circumference. Those give you a gauge as to whether you're falling out of your weight for your body height. All right, so having a healthy weight is so important. I cannot overemphasize it. There is an acronym that I use that helps me remember. So stay away from CRAP. CRAP means carbonated drinks, That's the C part of it. And then the R is refined sugars. A, artificial sweeteners, which we find in drinks, as you can see up here, limits consumption of sugary sweetened drinks. And then the P is processed foods, and that is the limit consumption of bread and processed meat. Those are all the things we need to be careful of. Fast foods, unfortunately, is high in fats, starches, and sugar. It has no fiber. When we eat foods that are more plant-based, we have more fiber, and that keeps us full. That helps our gut health. So our gut is producing healthy neurons, healthy hormones that is supporting our body. If we have unhealthy gut, then we have bad bacteria and we're not producing good support system to help us. All right, so this cycle over here just talks about diet rich in whole grains, veggies, fruits, and beans. Being physically active, the recommendation is 150 minutes a week, and that breaks up to about 30 minutes, 5 days a week. Now that's just basic, right? Just basic, doing that, staying active, and all through the day, not sitting down continuously, getting up and stretching makes a big difference. So these are things that we need to pay attention to. What are some other things that can help us prevent cancer, or just even breast cancer, particularly, as that's the topic we're talking about today? Limiting alcohol consumption. Alcohol, unfortunately, also has a lot of sugar, has a lot of chemicals in it that can affect the body in the long run. Now, there is some recommendation as to how much sugar that we can have. I mean, alcohol, and for men, they say 2 glasses, for women, less than 1. But again, you know yourself best. If you know, just for me, for instance, if I even do 1, I'm completely out. So I know that it doesn't even work for me. So knowing that if you drink alcohol and 1 is not enough and it takes you to 2 and 3, then you need to be very, very careful and mindful of that. Now, there's been some conversation about taking supplements, that does it really help cancer prevention? There's been no real data that has shown that. I think overall, let food be our medicine. Food can either be our poison or can be our medicine. So paying attention to what we eat and what we drink, what we eat, and our overall stress makes a big difference. Now, breastfeeding, so important for our young mothers. Pay attention to that. If there's any incentive to encourage you to breastfeed, definitely take that into consideration. I have 3 kids and I was able to, I didn't breastfeed them for a whole year. I did my best. Each child had less months of breastfeeding, but at least I gave them I made an effort to give them proper antibodies, and also for myself to, guard myself in the future against breast cancer. So those are things to be mindful of. Now, if for any reason we do have listeners that have been diagnosed with breast cancer, it's not the end of the world, meaning that there are ways to have it managed and controlled. I have several patients that are survivals, and I applaud everyone that, whether you have a family member that you've lost or you're caring for somebody, I encourage you that stay strong and be a source of hope to the people around you, and also to encourage screening for everyone. The reason why I pause here, if there is a diagnosis of cancer of any sort, is I've had patients that they've been diagnosed with cancer. Unfortunately, they go through chemotherapy, and no one tells them to pay attention to their sugar content. Unfortunately, cancer cells feed on sugar. That is what makes them light up. That's what makes them excited, and it replicates more and more. So we need to minimize our sugar. We got to get rid of things that our body does not recognize as food. So if there is a diagnosis, we want to stay away from acidic foods. We want to eat more alkaline foods. We want to eat more of anti-inflammatory foods, and more of anti-inflammatory foods would include, staying away from sugar, a lot of processed starch. We want to do more of lean protein, which is what I call food. When we talk about food, F is fruits and veggies, O is organic proteins, and protein can be plant or animal. Excuse me. The other O is omega fatty acids. Omega fatty acids, you can get that in your fish. There are some capsules for it. A lot of our plants give us omega fatty acids. And why is omega fatty acids so important? It's important because it helps us fight free radicals. So they're rascals. That's how I call free radicals. They're in the bodies. They're like, okay, what can I replicate? What can I destroy? So when we eat foods that are nourishing for our bodies, it actually gets rid of all those free radicals in our body. So again, if there is a diagnosis, if either you or your loved one has been diagnosed with cancer, there is still a way out. There's several people that have survived cancer. It's just having the right resources and the right information to help you. So I do have some questions here about dense breast tissue genetic. Yeah, so it is considered, yes, absolutely. It does run in the family to have dense breasts. And so for that, those are the patients that I have that would have to do the test maybe 1 or 2 more times, because you want to make sure you're not missing any calcification, any thickened structure or changes in the breast. So it can be genetically inclined. Yes, absolutely. All right, so let's keep rolling here. I spent some time here, but these are some of the foods, yes, foods that you need to have in your pantry. I love me some blueberries. My family sees me talk about blueberries a lot. I tell them it's brain food. If I have kids acting up, I ask them, have you had your blueberry today? It helps with the brain. It helps, it's a strong antioxidant. I love ginger. Turmeric is my favorite. I cannot have anything in my house cooked without sprinkling some turmeric. If you haven't already heard, turmeric is an anti-inflammatory spice. I add black pepper to increase the potency. You know, when COVID hits, I even increased the intake more, because there's been lots of studies and data that shows about turmeric and how it really helps to fight all those infections all around. Definitely cruciferous veggies. So the greener the veggie is, the better it is. Now, if you're not used to eating veggies, there's still a whole lot of, you know, kale, broccoli, cabbage. There should be one in that group that you would find that you can eat, you know. And I always say that you develop the taste buds, you know. I read somewhere that you would have to eat something, is it 70 times to be able to get your taste bud? No, actually, I think it's 7, not 70. So you have to eat it 7 times before you can conclude that it's not tasty or you don't want it. So don't give up on any food just yet. All right. Asparagus is one of those really, really good foods that help with your gut health. All right. Strawberries. So anything berries. Right? Lentils is really good. It has lots of fiber. Some people say, oh, I get bloated. I feel very gassy. Well, soak it overnight. That helps to decrease all the anti-nutrients that will make you feel bloated. And definitely drink water. Flax seeds are really good. Whenever I make my smoothie, I put flax seeds in it. Definitely whenever I cook my food, I put garlic. So these are some of those foods that fight cancer. They're called superfoods. Green tea has been shown to be helpful. Just be careful if you're taking the one that has caffeine. You don't want to affect your sleep. So you want to make sure that at least the last drink is maybe around 2 if it has caffeine, so that because it stays in your system about 8 hours. So these are some of the foods. All right. So yeah, as we begin to wrap up here, I definitely want to share some commonly asked questions. What are some of those things that we want to know, or we have misconceptions? The first one is definitely mammogram. Mammogram screening has been out for a while, so a lot of people quite aware that it's an X-ray where there is a little bit of radiation that goes into the breast just to identify the structure of the breast. It's not a heavy radiation, so it's nothing to fear there. You can't get cancer from the radiation that is used to get a mammogram. A second question that comes up a lot is where to get it. Definitely you need a referral, unless you are getting it at a health center where they're offering free mammograms. You can always have your doctors order, within the system. You can get it outside of your clinic, your primary care clinic, but it's definitely FDA approved that anyone that's certified can give you a mammogram. The next question is, when to schedule it. As I already mentioned, you want to be mindful of your cycle. You don't want to schedule it before your cycle because your breasts are tender. You could have false positive, meaning your breast is already lumpy and tender, and then you go and do a mammogram. I don't know if anyone had this issue where after getting the COVID vaccine, because of the reaction the body was going through, they had some lumpy breast. So a lot of people were encouraged to wait a couple of weeks after to schedule their mammogram so you don't have anything called like a false positive. So definitely paying attention to when you schedule your mammogram. It should really be after your cycle, if you still have your cycles. All right, other commonly asked questions. What do I wear? What not to wear? Definitely you want to wear something light. You are going to be asked to remove your top and your bra. You are going to, there's no indecent exposure, no. You're going to be really well taken care of. They say do not apply deodorant because you don't want anything interfering on that day. So just can have your shower, but just go straight to get your mammogram. You don't want to have all that antiperspirant or lotion because you're going to take time to be cleaning all of that off. So, and they can disguise as white spots on the x-ray. So you want to, so as I said, what to expect, I already told you what to expect, but just to reiterate, it takes anything to 20 to 30 minutes. If you're going to have a repeat, maybe because they found something, you could be rescheduled to have that done, or you could have it done on that same day. All right, but what to expect, it takes really nothing more than 30 minutes. And so your breast is compressed on 2 plastic plates. And what they tend to do is it'll be more flat, and then they can also make it horizontal. And it can be uncomfortable, but again, as I say, as I've mentioned, it's really to give us a result. We want to make sure that the breast is clear. It's preventable, so we want to make sure that we're able to detect it early. Now, when you get your mammogram, you want to make sure that you follow up with your results. I know we tend to hear that no news is good news. That doesn't always apply. So I would encourage you to definitely check back in with your doctor. If you get it at a free location, make sure you know how to get your results, right? You want to follow up with what your results. I've heard a lot of horror stories where they didn't hear back and they thought it was normal, or they just didn't even want to find out or know what happened. And unfortunately, there was an issue that could have been prevented. So please follow up. It usually takes anything from 7 to 10 days to get a report, to have it read by the radiologist, to have it reevaluated by the physician. So just make sure you follow up and find out what your results are. Now, the biggest question is, what if I don't have insurance, or I have a family member that doesn't have insurance and they don't want to get it done? It's going to cost so much money. Well, the good news is that they are free or low-cost mammogram services are available, and I have the information for the American Cancer Society, and you can always check in with them. I've had several patients that have taken advantage of that. I live in Atlanta, Georgia, and I work at Grady, and all our patients, majority of them that don't have insurance, they get to have their mammograms done, and no one is turned away because, again, as I said, it saves lives. So the question today is, what are you going to do? How are you going to prepare yourself, right? So I like this. It's talking about ACT. Action changes things. It is action that changes things. I mean, I've spoken today, I've given some information, educational information. I know that I'm scheduling my mammogram this year on my birthday. Because when I turned 40, I had a baseline, and now that I'm, going outside of the 45, I need to have that conversation. Am I going to start getting it every year now? I am going to act, right? I encourage you to act. I encourage you to schedule it. If you don't schedule it, if you don't put it on the calendar, it's not going to happen. So what is your act? What are you going to do? I hope that you are going to definitely consider it and definitely share with your friends and family and encourage them. I've heard of people where they have like breast mammogram celebrations where they go together and get their mammograms. And I think that's fun, where if you're able to schedule it at the same time, you get it done at the same time. But definitely making sure that we encourage each other to get screened. And I know a lot of people say out of mind, out of sight, but that does not follow with breast cancer, especially where we see that 1 in 8 people are diagnosed with breast cancer. So we definitely need to have that scheduled, and there's tons of resources available to encourage us to get screened. Now, there was a question about alkaline water. Yeah, so alkaline water, when we talk about just alkaline foods, so foods that are not acidic generally, very, very beneficial to our health, overall health, because our body, there are 3 main things that happen with our body. So if we have inflammation, we have a lot of cytokines. So those are things that are just causing a lot of inflammation and havoc all over our body. So inflammation is not good. When we have inflammation, it causes our insulin resistance, especially if there's increased weight gain. And so all those things are triggered by acidic foods. So when we have alkaline, it neutralizes our bloodstream, it neutralizes all those free radicals that I referred to initially, and it stabilizes the body. The body is able to heal and be receptive. And then the third thing definitely is our gut health. Our gut is so important. It is the second brain. There's a lot of communication that goes on in the stomach, in the GI tract, and just recent discovery, we actually have more bacteria cells than human cells, and a lot of the action takes place in our gut. So there's a lot of message that goes between our gut to our brain with the neurotransmitters, which tells the body what to do, and our hormones, right? We have growth hormone, we have our sex hormones, right? Estrogen, testosterone, all those things. How are they produced? It's really produced in the gut. Most of them are there. So if you don't have a healthy gut with healthy bacteria, we just have bad bacteria that is just giving us wrong signals, and then you have leaky gut. So alkaline water definitely helps. And alkaline foods, where we talk about the greener greens, so the cruciferous greens, they have a lot of polyphenols, and those are anti-inflammatory substances. So that's why you hear people say, eat the rainbow. If you eat the rainbow, then you get all those healthy structures from the plants that gut health needs to be supported. So definitely making sure that even if it's just one thing you do today, which is schedule your mammogram. If you're of age, right? If you have a family member, talk to them, encourage them that they need to get a mammogram. Even if there's insurance is an issue, the American Cancer Society is available to help. There's a number there. I've seen several family members or friends and even patients that have availed themselves of that opportunity. So schedule, know what your risk factors are, ask those questions, and then pay attention to those lifestyle habits, right? We talked about number 1, eat healthy diet plays a big factor, because cancer cells don't just happen overnight. It's over a period of time that it occurs. So we want to make sure that we're supporting our health with foods that are nourishing. All right. And then we want to get rid of the things that are not nourishing. Now, we're creatures of habit. So I'm not saying it's easy. It sounds simple, right? It might not be easy. But learning those strategies that will get you to the place where you need to be. So even if it's just one thing that you do, maybe just add 1 more serving of salad or greens, right? The recommendation is 3 servings of veggie and 2 of fruit, so 5 servings. And this month of October, it's not just breast Cancer Awareness Month. It's also Eat Together, Healthy Together month, where we need to pay attention to what we're eating. So definitely adding 1 more salad. What I do that helps me get my veggies in is I have a serving with my smoothie. So I have my veggie and I have my fruit. So I know some people and I was guilty of this, where I just had fruits. That was all I had in my smoothie. That was too much sugar. Good sugar, but too much. You have to balance it with greens, right? So I have my base as kale or spinach. So that's my first serving. My second one is a salad. I have developed that taste for salad because I know it's good for me. It's helping fight the free radicals, right? So I've developed a taste for it. I make it fun, because if it's not fun, it's going to be boring and you won't want to do it. And I'm all about fun, right? So definitely paying attention to that. Other things that I do to get my third serving of veggie, which again is 3 servings, right, is my meal. So like if I'm having breakfast, I could make my eggs with onions, mushrooms, tomatoes, whatever it is that you like, right? Or maybe for dinner, have a side of veggie. So that counts for my 3 servings. Now, what's about my fruit servings? My fruit, now there might be some people here that will say, well, I have diabetes. Am I supposed to be eating fruits? Yeah, well, there are some fruits that have higher glycemic index. Maybe they'll spike your sugar a little bit more. But I just want you to pay attention to the fact that fruit still has a lot of nutrients in there that is beneficial for you. So I recommend pairing it with a healthy fat. So like maybe if you're eating apples, sprinkle some cinnamon. It helps to regulate your sugar, or have it with peanuts or nuts. I like to have it with nuts. So just make it, not that you're just eating a fruit only, you're also having it with a healthy fat. So that together definitely helps to, get your fruit serving. And then I have oranges. So that's how I count for my 2. So if majority of your food is foods that are nourishing, then and you're full with fiber that gives you good bowel movement, and you're eating more of your food than drinking your calories, then you begin to feel the difference in your body. You feel whole, you feel vibrant, and you definitely are healthy. And this is even more important if you've ever been diagnosed with cancer, to minimize the replication of the cancer cells. So I'm sure you might have heard some people say, oh, well, I was diagnosed with cancer and I changed my diet and, I healed tremendously. So it is possible, it is doable. So I want to thank you all for your attention. Thank you for giving me this opportunity to speak with you all today about breast cancer risk reduction using lifestyle medicine. We can do this together. It's not impossible. We can do it. We just need to have the right resources, right information. We need to encourage one another. Yes, we need to stay on top of things. Yeah, so thank you all so very much for tuning in. I hope that you have benefited from this as much as I have, because I've been triggered to make sure I get my mammogram this year. All right, so I'm Dr. Babs, your host for the Holistic Perspective WCEG Network show. It's a great pleasure to host this, and I thank the organization for just empowering the community. Mammograms have saved lives. We just need to make sure we don't have a decline. We need to keep saving lives. We need to keep getting detected. We need to make sure that we stay whole, vibrant, and healthy. Now, we are going to return again next month for another wonderful episode, and that will be November 16, I believe. We'll confirm the date, and we will be talking about stress management. So the month of November, we have a lot of things in November, right? There's Thanksgiving, and a lot of times doing all this wonderful family gathering, sometimes it could be stressful. I know I enjoy family company, but I do get stressed because you're trying to buy gifts for everyone and please everyone. So we're going to be talking about some tactics and ways to reduce our stress, because stress is also not good, right? Stress increases your cortisol level. You're in a sympathetic mode the whole time, all this flight, and that can also cause free radicals that can cause a lot of problems. So we're going to be talking about that. But before I tune out, I want to leave you with this nugget that prevention is better than cure. Prevention is better than cure. Definitely what you're able to prevent. And that's what lifestyle medicine is all about. It's preventing, treating, and reversing. So prevention is better than cure. Please do not say it's better. I don't know. What you don't know doesn't kill you. I think I've heard that somewhere. So, but no, we're better than that. Let us find out. Let's just get it done. Let's save save ourselves from any preventable costs. All right, so thank you also very much. I want to thank the organization once again, and I want to say that you all take care. You all take care and stay blessed until next time.